Guys, I'm starting to really wonder whether or not children should be in therapy. I don't mean this in some monolithic black and white way, but I am asking it as a really serious question. And I'm asking it as a therapist who knows the limits of what this work can do, and as an adult who was a child put in therapy. When my parents were the ones who needed to be in therapy, and many of the other systems that I was interfacing with needed mental health interventions, but I didn't. And I certainly couldn't make the changes necessary to manage my own anxiety. So my concerns about children in therapy at this point are, one, the interventions that are being used, which include CBT, DBT, ABA, TFCBT, all these alphabets, that basically are obsessed with outcomes and children producing outcomes that they're really not responsible for producing. And most of these outcomes are fixated on the idea that children are supposed to think differently, but have not much to do with helping children play, attach, and learn to trust. The other concern I have is that these interventions get in the way of how children think about what's happened to them and ask them to rethink things so that those things don't feel as painful to them. And in fact, we need the rawest data of how things feel to children because that's where the truth lies. That's how we know how much harm is really happening. And we can't get in there and edit that if we want access to truly changing the well-being of children. And lastly, the reliance on therapists and children to fix larger global and local problems in 50-minute chunks once a week completely takes away from what it means to be a child and to be developmentally attuned to a child's needs, which are not contained within a therapeutic frame, nor should they try to be. Most importantly, if a kid's in therapy and their parents aren't, I wouldn't serve that family. I just wouldn't. It doesn't seem just. It's not the kids' problem to fix 99% of the time.